1. Which of the following best reflects the Texas Nursing Practice Act's primary purpose? A. To promote continuing education opportunities for nurses. B. To ensure nurses are financially compensated fairly. C. To protect and promote public health, safety, and welfare. D. To establish federal guidelines for nursing practice in Texas. 2. When evaluating nursing jurisprudence compliance, which of the following most effectively demonstrates regulatory adherence? A. A nurse consistently attending staff meetings. B. Documentation of adherence to Board of Nursing rules in practice records. C. Following only facility-specific policies without referencing state law. D. Engaging in volunteer nursing activities outside of work. 3. A nurse educator designing curriculum for jurisprudence training should prioritize which learning principle? A. Rote memorization of statutes. B. Active engagement with case-based scenarios. C. Passive lecture delivery of rules. D. Elimination of assessment checkpoints. 4. In the context of Texas nursing jurisprudence, which communication approach best supports ethical mentoring? A. Avoiding difficult discussions about errors. B. Providing constructive feedback with reference to board rules. C. Focusing only on positive reinforcement regardless of errors. D. Delegating feedback responsibilities to administrators. 5. The Nurse Licensure Compact, NLC, allows Texas nurses to A. Practice only within Texas boundaries. B. Obtain separate licenses for each compact state. C. Practice across other compact states with one multi-state license. D. Exempt themselves from Texas board oversight. 6. A key requirement of the Texas Nursing Jurisprudence Exam is A. Passing a federal competency exam prior to state licensing. B. Completion before the first license renewal. C. Annual completion of the exam. D. Automatic waiver for nurses with advanced degrees. 7. Which evaluation method best assesses whether a nurse understands delegation rules under Texas law? A. A true-false quiz. B. Role-play scenarios involving delegation to unlicensed personnel. C. Group discussions without structured assessment. D. Informal peer feedback. 8. Which of the following best illustrates unprofessional conduct under Texas board rules? A. Refusing an assignment due to lack of competence. B. Failing to document care provided. C. Seeking mentorship to improve clinical skills. D. Reporting unsafe practice to a supervisor. 9. When teaching jurisprudence, adult learners are most likely to benefit from A. Examples linking regulations to real workplace dilemmas. B. Memorizing board meeting minutes. C. Repetitive reading of the Practice Act. D. Isolated review of outdated case law. 10. A nurse who falsifies patient records violates which principle in Texas nursing jurisprudence? A. Academic integrity. B. Duty to maintain accurate documentation. C. Financial accountability. D. Confidential mentoring obligations. 11. Which component of curriculum design ensures jurisprudence content aligns with regulatory standards? A. Random selection of test items from textbooks. B. Integration of Board of Nursing rules into learning objectives. C. Focus only on institutional policies. D. Avoidance of evaluation for efficiency. 12. To ensure ethical mentoring and jurisprudence training, the mentor should A. Provide guidance grounded in the Nursing Practice Act. B. Focus exclusively on clinical techniques. C. Share personal opinions without reference to regulation. D. Avoid discussing board disciplinary actions. 13. The Texas Board of Nursing requires continuing competency to ensure compliance with financial reporting standards. E. Promote lifelong learning and safe practice. C. Reduce the need for legal oversight. D. Replace the requirement for jurisprudence exams. 14. Which regulatory compliance standard requires nurses to maintain patient confidentiality? A. HIPAA and Texas Board of Nursing rules. B. Facility scheduling policies. C. Nurse licensure compact policies. D. OSHA workplace safety regulations. 15. During a jurisprudence workshop, the most effective formative evaluation tool would be A. Short reflective essays applying law to practice scenarios. B. End-of-year standardized testing only. C. Verbal lectures without participant interaction. D. Reviewing outdated jurisprudence exam questions. 16. Which communication skill is most important when discussing jurisprudence violations with peers? A. Using technical jargon to show expertise. B. Direct, respectful language aligned with board expectations. C. Avoiding specific details to maintain comfort. D. Deferring to administrators without dialogue. 17. Which of the following is a nurse's duty when identifying unsafe practice? A. Report unsafe practice according to Texas Board rules. B. Ignore unsafe practice to protect colleagues. C. Delay reporting until annual evaluations. D. Post concerns on social media without documentation. 18. In adult learning, jurisprudence concepts are best reinforced through A. Abstract theoretical models only. B. Active problem-solving and self-assessment. C. Passive note-taking sessions. D. Extensive memorization of legal citations. 19. Which disciplinary action can the Texas Board of Nursing impose for violations? A. Promotion to supervisory roles. B. Revocation or suspension of license. C. Salary increase as a corrective measure. D. Waiver from continuing education requirements. 20. Which best reflects the role of the Texas Nursing Jurisprudence Exam in professional practice? A. It is optional for nurses licensed in other states. It confirms a nurse's knowledge of legal and ethical responsibilities. C. It eliminates the need for ongoing regulatory education. D. It replaces facility-specific compliance training. 21. When assessing jurisprudence understanding, summative evaluation is best achieved through A. A scored examination at the conclusion of the course. B. Informal conversations among peers. C. Mid-course anonymous surveys only. D. Daily attendance tracking. 22. The scope of practice for vocational nurses in Texas is A. Identical to that of registered nurses. B. More limited, requiring supervision for certain activities. C. Unrestricted, once licensed. D. Defined exclusively by hospital policy. 23. Which of the following demonstrates compliance with documentation standards? A. Charting only when time permits. E. Recording care promptly and accurately per board rules. C. Avoiding documentation of minor interventions. D. Delegating documentation to unlicensed personnel. 24. To align with adult learning principles, jurisprudence instruction should A. Include practical examples nurses encounter in practice. B. Emphasize memorization of all board members' names. C. Focus entirely on historical development of nursing law. D. Provide no opportunity for learner self-reflection. 25. Which of the following is considered professional boundary violation under Texas jurisprudence? A. Accepting small tokens of appreciation from patients. B. Entering into a romantic relationship with a current patient. C. Educating patients about safe medication use. D. Refusing to accept gifts that exceed hospital policy. 26. When mentoring a new nurse, the mentor should emphasize jurisprudence principles by A. Modeling compliance with delegation rules and documentation. B. Providing personal shortcuts for completing tasks. C. Avoiding discussions about board regulations to reduce stress. D. Using outdated exam preparation guides. 27. Which Texas Board of Nursing rule addresses continuing competency? A. Rule 217.11. B. Rule 219.12. C. Rule 216.3. D. Rule 220.1. 28. The legal duty of a nurse under the Nursing Practice Act includes A. Practicing within one's scope and competence. B. Expanding duties beyond training to assist colleagues. C. Following only employer policies. D. Substituting physician orders with personal judgment. 29. Which learning strategy would most effectively prepare nurses for the jurisprudence exam? A. Small group case analysis tied to regulatory rules. B. Memorization of entire Texas Administrative Code. C. Passive listening to a one-time lecture. D. Independent study without assessment. 30. In regulatory compliance, failure to report suspected child abuse constitutes A. A violation of Texas law and board rules. E. A professional development opportunity. C. An acceptable exercise of discretion. D. A private matter between nurse and family.